three things. We measure, our bread and butter is we measure empirically how people's jobs impact on their health and well-being, which then allows organisations and people such as yourselves, it then informs your decisions about the scope of what that programme should involve and contain. And I'm going to show you a case study from London Overground, and Vince in the background, he was actually, we worked together on this a little while ago, so if you've got any questions, ask Vince. So this is our bread and butter. We're independent, we've got no skin in the game, so we measure stuff, but then that's all we do. So we stick to the knitting. You know, I don't have a room full of sort of shiny-shoed consultants who I've got to then send out and do lucrative sort of consulting projects. So, and I think there's some integrity to that, keeping measurement and delivery separate. So, so that's the insight piece, and then there's the implement. Using the evidence we've collated and developing the narrative, we help clients to implement programs, and sometimes, you know, we help clients sort of tweak what they've already got going because maybe it's not doing quite what they want it to do. But the most important thing is, and something I'm really proud of, is that we are independent. I'm a doctor, but I'm not a medical doctor, I'm a PhD doctor, and my PhD was in how you measure this stuff independently and rigorously using some really cool methodologies that have been tested and published in the academic literature. Okay, so people have alluded to this morning about what we mean by health and well-being, and forgive me if if I'm repeating stuff, but it is, you know, it is not just the medicalised stuff. In fact, very often it isn't the medicalised stuff; it's the other stuff. It's the important things are, if you look at the literature, it is subjective. So it is what is you as an individual think about how you are, not what other people think. And it's your interpretation or your employees' interpretations of an event that should prevail, not the event itself. We should be capturing what employees themselves deem to be most important. It's multidimensional, and guess what? It varies between sectors, organisations, roles, you name it, because it is so subjective and it's dynamic. So what does that mean? That means that one size does not fit all, and the cookie cutter approach does not work. It's not effective. So the more you can tailor and bespoke towards your employees' needs, the better. We've been doing this for 10 years, and through the measurement work we do, there are, in the main, I would say, 7 domains which regularly present themselves as areas of people's jobs that impact their overall health and wellness. And some of them, you know, some of them you'd expect. So this is the slips and trips. This is more health and safety, but we keep this in here particularly if we're looking, you know, we're working with a big construction employer. Your boss. I think we've all had bosses like this. I certainly have. But your boss, your line manager, that has a huge impact on people's employee well-being. Career development. We know we go to work for a number of reasons. We go to work to earn a living, but one of the other reasons we go to work is to acquire new skills and develop new skills and experiences. So career development is a very important part. Musculoskeletal, we hear a lot about that. Home-work balance, we heard about that this morning, and again, this is an area that's increasingly attracting interest. More sort of hazardous chemicals, this kind of area. Stress, anxiety, and depression, and then the last one is one of my favourite. This is the actual physical environment. In one of the presentations with the Great Place to Work presentation, they talked a lot about this. This is often ignored. Now, if you're in a bank in the city, probably the physical environment is okay. But believe you me, there are a lot of organisations where the physical environment is shocking, absolutely shocking. And it's a bit like Maslow's hierarchy. Unless you've got the shelter right at the bottom, you know, a resilience program ain't gonna touch the sides. So, and one of the case studies, the London Overground one, we actually, this this is highlighted quite significantly. So that's a whistle-stop tour on what I would consider to be the main elements, the main constructs of this thing called employee wellbeing. Now, I was asked to talk about the evidence, so being a good academic, why is evidence a good thing? There's a great paper by Ron Goltzer. If you haven't got it, I'd encourage you to get it. I think it's probably on Google. If you can't find it, I can send you copies. But he came up with the 5 ticks. You know, if you can tick these things, you know, you are halfway there to doing something that's going to be effective and produce results. And some of these, in fact, 3 out of the 5, they all talk to the evidence that you should be gathering. So first of all, the program should be evidence-based. It should fit with the workers' needs. So again, you need the evidence to identify what the needs are and be able to prioritize them. The goals are aligned to that of the business. The most important, or the most successful wellbeing programs are where they are integrated with the business goals. They are not sort of out there completely separated in a parallel universe. There should be ongoing evaluation, so you can tweak as you go, and this implies you've got some goals and metrics in mind that you want to meet. And then finally, there's an established wellbeing culture. So if you've got evidence, you are going to be able to make some informed decisions around your strategy. Should it be on mental health? Should it be on physical health? You know, who in your organisation needs what? It justifies your choice of program. You can establish your priorities. And also, you've got a baseline against which you can measure progress, which takes us neatly into the ROI in a little while. So, evidence sources. Obviously, I can help you with gathering evidence, but there are lots of other ways I'd encourage you to think about it. A lot of employers, the fun stuff is developing a program, you know, and designing something, and sometimes the evidence sources can be overlooked. So, if you have some absence records, I know they're not always very good, but if you have absence records, what are they telling you? So that's a good place to look. Is it short-term? Is it long-term? Is it musculoskeletal? You know, is it mental? Is it dental? I don't know, whatever it is. But how, you know, what do your absence records say? If you've got an OH provider, what is the management information coming from them? Are there any trends over time? If you've got an EAP line, EAP is only what 3%, I think, take up 3 to 5%. So, you know, it's not going to be hugely representative, but it might tell you something that's worth looking at. You might have some screening going on for your staff. If you aggregate up the data, what are the biometrics there? And what about, you know, being in the city? You know, have you got a private medical program? In which case, what are the claims coming through? And the same with group income protection. You might have a staff survey. If you have a staff survey, there might be some questions in there on wellbeing. Probably not very good. But, you know, what do they tell you? And then finally, exit survey data. So here's some suggestions about some of the places, some of the bonnets you might look under, just to start digging around to find out what you've got already. If you don't feel you've got enough data, and my guess is you probably haven't, and you feel the need to lift up the bonnet and have a bigger route around, here's some other thoughts. So we develop validated, anonymized assessments online. They have really good clinical measurement properties, so that means they do what they say on the tin. And it enables us to systematically measure employee well-being in your organisation. And we can link these to business outcomes. So remember what I said about linking it to the business. If you can ask some questions and then empirically map them to outcomes, so if you're a law firm, it might be utilisation rates. If you're a hospital, it might be patient safety. when you start to do that, the lights go on and you start having a different kind of conversation about employee well-being. And perhaps some of your business cynics, if they can see links, empirical links between well-being and some of these outcomes that are dear to their heart, you start having a better, more informed, interesting conversation. So we have standard assessments, 25 questions, which are good. They're good for office-based companies. Sector ones, so obviously we've got a rail one, we've got construction, law firm, banking, aviation, and a number of other ones as well, call centre ones. And then if you really want to go for it, we can tailor specific ones for you to really address what are the key issues going down with your employees in your sector at this time. Like I said, they're all anonymised and they take between 5 and 7 minutes, and we usually get a 70% uptake because the questions are all about the employees. They're not about visions and values, all those things. They are about what is it about your job that is most important to you, and your well-being. And I'd be very happy. I can set you up and you can have a look at some of these for yourself, just to see for yourself. So here's a case study. This was one we did very recently. This was a huge employer. It's public sector one, 90,000 employees. They wanted, they were on a deadline to develop and publish a strategy by the end of the year. They had the absence data, they had occupational health data, EAP data, but they weren't able to rank and prioritise what their key issues were. And apologies, you can't really see this at the back, but they had already made publicly known 4 commitments about health and well-being at work. So I helped them to design, we've got 6 questions here, and we asked employees, this went out, we had a week to do it, this went out to 10% of the workforce, and we asked them to indicate how much they agreed or disagreed with these statements. And it ran from 1 to 4, where 4 is bad and 1 is good. And I've just circled these 2 because the one at the bottom is, I believe XXX supports and promotes positive mental health behaviours at work. And this one is about positive health, physical health behaviours. And then guess what? We've got my little friendly office environment there as well. So this immediately gave us an idea about where to focus effort and resource. They'd indicated that they did have good relationships with their colleagues and their line manager. They indicated their line manager did care for their health and well-being. So that's really good news. That's good. We'll bank that. But there's some noise here about mental and physical health and supportive behaviours at work. We then asked them to just rank and select 3 out of 7 sort of health profiles that they considered to be most important to them. And what we have way out in front is this one, which is mental health, followed by healthy lifestyles, maintaining a healthy lifestyle, followed by financial well-being. Now, this organisation thought physical safety was going to be very important, and they also thought managing health conditions was going to be very important, mainly because they were very influenced by their occupational health provider. However, what this data quickly showed us is mental well-being, maintaining a healthy lifestyle, and financial well-being. You can't do everything, and it's best to do a few things well rather than lots of things not very well. So this is where our focus was. And based on this data, they were able to justify spend on manager training around mental health support, which we've heard about this morning, looking at how to influence leadership behaviours to bring mental health into the conversation. Every week, each employee has a one-to-one with their manager, and they are introducing a time to talk section. And then also they're blowing the dust off an awful lot of initiatives they've got running, but nobody knows about them. So they're kind of recasting, relaunching a lot of the material and then introducing some strong signposting. And then on the healthy lifestyle, they've developed a portal and they're putting a lot of information on there for people, and then they've got a very good calendar of activity running. And then on the financial support, there's we're talking to a couple of providers about some of this debt management stuff. So it's a very, very clear, simple program backed up by the evidence, and it has got the support of the leadership because the numbers are there to justify the choice and the balance. Case study 2, this is London Overground. Vince, I hope I've got this right. So they had high engagement using their engagement survey things, but they also had high sickness. So there isn't necessarily a relationship, a linear relationship between sickness and engagement. And the absence, sickness absence, just in direct costs alone was hitting them at about the 1 million mark every year. So because trains and transport is very different to your normal sort of office, white-collar office environment, we developed and validated an assessment just for people working on the trains, and these weren't the drivers, these were people working in the station offices and people, the conductors, and people working in the stations. So there's lots of different domains here. One of them is uniform. Uniforms are really important to people working on trains. And this is shift work. Sorry about the abbreviation. So this just shows us questions that sit under each of these different domains. This is different to your usual one because it is tailored specifically to the trains. But the longer the bar, the worse things are. And this shows, without a shadow of a doubt, that how work impacts on people's psychological well-being was most important to these people, followed by our old friends, this is facilities. So this is to do with the messes at the different stations where, you know, people on their turns had a break before going back out on the trains and meeting the public. So again, with this kind of data, we've got a strong agenda, you know, to develop something that is based on the needs of the workforce. And we are also able to map this against some outcomes that were important to the employer. And absence was, I can't remember what the absence levels were. Can you? I mean, they were fairly high. They were above norm. But we were able to show the very, very fantastic relationship between people's well-being and their annual absence. And this showed that people who had low well-being, they're in the lowest quartile, 2.5 times more likely to be absent, which is a lot. It's a huge amount. And then similarly with engagement, staff who were in the low well-being quartile, i.e. these people, you know, they were indicating that they were unhappy with lots of different things like shifts, uniform, facilities, manager, 75 more times likely to be disengaged. You can see the lovely linear relationship here, depending on where they went. So, when you show this kind of data to your board, and you know, we went along to the board at London Overground and shared this data with them, along with some recommendations, you have a much easier ride because you've got some numbers based on, you know, the actual workforce that we were talking about. So we're also able to show, and Vince, we were talking about this just now, you know, this is a bit of statistical modelling to do with absence, but this shows actually people's views on lack of waterproof trousers was very, very, it wasn't a drive, I've got to be careful about my language, but there was a very, very, very statistically significant relationship between people's views on their uniforms and sickness absence. And then similarly, back and leg problems from standing up a long time on trains, sickness absence, yada, yada, yada. I don't know if you know about p-values, but this is highly, highly, highly significant. So again, with this kind of data, you can have a different kind of discussion with your budget holders about why you want to spend money on well-being and the kind of returns you think you can expect. So based on that, we were able to show that there was people were experiencing a lot of stress from service disruption. I haven't done work with Southern. God only knows what those poor people are like at the moment. But there was a lot of stress coming directly from service disruption. There was a lot of bad feeling around protection from bad weather, shift system when they weren't happy with, low quality facilities, and lower limbs were getting a hammering from the kind of work people did. So based on that, there were various interventions that were brought in on the back of it, including waterproof trousers. And here's the data, and this shows that attendance improved significantly by over 0.5%, which is quite a lot. And the days lost to absence were reduced by 1,600 a year. Anyway, when you quantify that all out, just in direct costs alone, this showed a saving of 340 grand.
Sorry, can I just ask about a question about waterproof trousers?
Yes.
It's very specific.
Yes.
I just wondered how you decided
to pick waterproof trousers. Because it's a good question. There is we follow a methodology called impact analysis. I can send you a paper on it. And through an iterative empirical process of elimination, we're able to identify which of all these different indicators of well-being are most important to the majority of people. And well-being, waterproof trousers came out as a very important one for that train operator. I do work with other train operators, and waterproof trousers ain't there. But this is the point, that's the whole point really, and that's the beauty of this kind of approach. You are really honing in on what's really important to those people that you want to reach. So actually giving them free fruit on a Friday, no chance. Give them some waterproof trousers and we're home and hosed. But there's, I have a master's in clinical research, and it is based on a really robust impact analysis to identify what's most important to those people. Okay, obviously we can do the analysis. When we collect the data from these assessments, we can do the analysis ourselves, but we've also built this platform where if you want, you can do it, and you can dig around and sift and filter through the data, develop and slice and dice as many reports as you want at your leisure. So if everything's going to work okay, there's just a little short video I want to show you on Health Hive, which allows you to do all this stuff. And then I'll talk a little bit about ROI. Okay? See if this works. Yes.
Health Hive is our secure, user-driven, interactive platform that houses all the data collected from our wellbeing assessments. Organisations use the findings to inform their health and wellbeing activities. Health Hive is unique. It is the only such platform available that enables employers to sift and filter their own employee data as soon as it becomes available. Health Hive is simple to use and is accessed via a secure user login. While an assessment is running, organisations can track response rates, and as soon as it is closed to staff, they can immediately start to examine their data. This is the landing page. Here we are looking at some results from our standard wellbeing assessment, Hive 25. In the top right-hand corner is the overall score for the organisation, and it's coded using the red, amber and green traffic light system. As its name suggests, Hive 25 is made up of 25 core questions, which are grouped into the 6 domains we use to describe the different elements of employee well-being: physical, psychological, managerial, work-home balance, developmental, and the physical workspace. Health Hive ranks all results according to their score, so clients can immediately see where things are going well and where there is room for improvement. Below the domain chart on the landing page is the heat map for all individual questions. Our easy-to-use graphics can be downloaded and edited to different formats, colours and text. On the left-hand side is our navigation panel, where employers can filter their data by one or more subgroups. When filter options are applied, it's possible to carry out a detailed summary and create graphics such as this spider web or this bar chart, which show how subgroups compare across the domains. As well as being able to examine domain scores, it's possible to explore scores for all individual questions. Scores for particular filters and subsets of questions are shown in the top right-hand corner. to benchmark them against the overall score. For more information about Health Hive and our assessments, go to our website at workingwellbeing.com.
So that's Health Hive. So if you've got some data, either from our assessment or from the other buckets you might think, and you go in and you negotiate some investment to deliver a program, I think it's fair dues, and it's becoming increasingly apparent that people want to see some sort of payback on all this. So I just thought I'd give you the 5-minute view on what I think are good ROI options and what I think aren't so good. So I think there are I've written on this recently, and if anyone wants a copy of the article, I'll be happy to share it with you. Fiscal return, which is the official sort of ROI definition, is really tricky to do, because it's not like an advertising campaign where you develop an advertising campaign and sales of your shampoo go up. Health is not like that. Dee Eddington, who's done a lot of work on all this, he reckons it takes between 8 and 16 years to show any sort of really, really good, credible fiscal return to come through. And some of the earlier studies, I don't know if you're familiar with them, where people say, they for every pound spent, they've got 4 back. Most of them have been what they called retired, because they are not based on very good assumptions. So I wouldn't, if I were you, promise proper fiscal returns to finance director. What you can do is rate of interest. That's another type of ROI. So if you're developing, I don't know, some sort of resilience program, you can actually measure how many people attended, and track that over time. If it's I don't know, a course that goes on for 6 weeks, how many people were still there after 6 weeks compared to the first week. So it's quick and cheap, but it's not ideal. Just because people are eating lots of fruit that you're putting out, that doesn't mean to say people are getting healthier. But it's something. It's better than nothing. This is the one I really like, and I've got a case study to show you, realm of influence. So this is where you're not really doing fiscal stuff, but you are picking some outcomes that are of interest and of relevance to you as an organisation, and following them directly with your program. More about this in a minute. The final one is ring of illusion. There's a lot of rings of illusion out there, put out by vendors, and also I think by employers who under pressure say, yes, it's been brilliant, it's been absolutely brilliant. Everybody, our absence rates have gone down by 20%, but actually, when you scratch below the surface, it's quite illusionary. I think what people are sometimes claiming. So beware those, and I'll just talk to you a little bit about realm of influence, which I think is where this industry is going. So this is a study we did with guys in London earlier this year. Very big, very busy trust, high levels of the stress and anxiety, and one of the issues was email. Probably not dissimilar to some of the people in this room. This was cited as a real problem. So what they decided to do was pilot some email training. I don't know if any of you have done email training. I think there's some good guys out there and some not great guys. But what they decided to do is they decided to just pilot it using some test conditions. So the test conditions were, some people attended training, so a 1.5 hour training slot. Some people would just email some guidelines on email training and etiquette, and some people didn't have anything. So we had the sort of intervention group, and then we had 2 control groups. And we did a before and after, time 1 and time 2, asking people to self-report on various indicators. And I've just picked this one out to show you. So those that had the training showed that after they'd attended the training, they believed that their email usage allowed them to work more effectively under pressure. Compared to people who received nothing, you wouldn't expect any change there. And these people who just received guidelines, there was a little uplift. But we're able to do some statistics down here to show this is actually a really significant result for the people who attended the training. We also measured people, how long they spent on email. And this just showed, this went to the board, that we were able to show empirically and robustly that people who attended the training saved 31 minutes a day. There was a 9% uplift in effectiveness, 10% uplift in people's ability, 13% improvement in their ability to work effectively. And over 23 email-related wellbeing indicators, every single one of them showed a tick in terms of against baseline. There was an improvement, particularly around distraction, stress, and disruption to work. So this is quite powerful stuff, and this is what I'd encourage you to do. If you're starting out if you want to try something, do it as a pilot. Do it with a control group or a couple of control groups, and just see what you can show in terms of evidencing the impact you're making. So based on that, the results were shared with the trust executive, and this email training is now being rolled out with confidence to the trust. So as you can see here, Stephen Brownlee was associate director there. He said that actually the statistics show email productivity has had a significant impact, blah, blah, blah. So he was really pleased. The email training company were delighted, but it meant Staten, could make with confidence this decision with 9,000 people to look at this intervention as something that really had an impact and was hitting one of those indicators. So that's what I mean by realm of influence. This is the kind of ROI I would encourage you to look at.